Okay, this person asks, what do you do if you have multiple structural injuries that requires surgeries, but you can't do them because each one contradicts the other? For example, I have PTTD, which is, by the way, posterior tibial tendon dysfunction, a severe hip labrum tear, thoracic outlet syndrome, and a scapula-lunate ligament tear in my wrist. I can no longer do the hypermobility exercises that were helpful for me before, and I'm hopeless now. All right, well, let's unpack that a little bit here. And first, my heart goes out to you for sure, and everything that you're going through. And to anyone watching this, I'm hoping that we can at least move the needle a little bit on this and break down if you're going through something similar, where you have multiple physical things going on with your Ehlers-Danlos or hypermobility spectrum disorder. So let's unpack this a little bit and see if we can, for anyone that's dealing with multiple physical things at the same time. I just have to always put this out there that this is not medical advice. I'm just commenting on what I would do if I were in this situation myself. You know, one of the things that sticks out to me immediately is the whole thing about the hip labrum tear and the comments about multiple issues requiring surgery. So the first thing I would always ask, like, when I asked someone when they said that, let's just say you're a patient coming into the clinic, we'd always want to look at your medical history, and we want to ask, like, how are we certain that this is a surgical requirement? How many people have really looked at your case? Have you had more than one surgeon look at your specific case? Because I have a lot of experiences with labral tears because I have one myself in my left hip. And so if for instance, anyone watching this also has that issue, which is really common in EDS and HSD, I would always recommend that people get more than one surgical opinion, because if you're just going on one surgical opinion, you may get pushed into surgery when it's not really required. Many labral tears can be they can be rehabbed. It just takes a long time. So I would recommend that you find someone who is EDS-Informed. So I would say that here. And where do you find a lot of these people? Well, if you're not familiar with the Ehlers-Danlos Society, I would always start there. They do have a directory where they list several of the professionals, and then you further have to do some vetting from there. Another option is to look on some of the support groups on Facebook and ask around there, because the outcomes in orthopedic surgeries aren't as good with EDS and with HSD for multiple reasons. Slower healing time, of course, it's a connective tissue disorder, so all of these can delay the healing or even just lead to poor outcomes. So whenever possible, we want to avoid surgery unless there's severe loss of function or progressive neurological loss, is what the evidence would tell you. And most forward-looking surgeons would tell you as well. So I definitely recommend checking that out. Now, if you're like this person who posed the question, then I would also think about, like we talked about this in several other videos, and one of the things I would think about is, again, this idea of the foundation of where things come from. I've used this analogy a million times now, but it's like building a house. And if we look at the lower part of the body, we have so much connective tissue in the pelvis and in the lumbar spine, so many ligaments, everything. A lot of the weight-bearing force is going through your pelvis. So things have to be in tip-top shape there. So I would make sure that you are seeing an EDS-informed physical therapist, working with people like that, and maybe even a physiatrist too. I would add that in here. I would say getting a physiatrist on your team, which they are a physician who specializes in rehabilitative medicine, and they tend to be extra smart, and they can help find some things that you may not have thought of. And there are some of them out there that are quite familiar with EDS. They tend to be top of the top. So what I'm saying is, start with that foundation. Like, really build up your strength in the pelvis and in the low back, and then begin to build up the chain. I understand, for instance, like if we go back to the original question, like there are these things that are going on in the upper body, like the thoracic outlet syndrome, some things in the wrist. Those could be really painful and disabling. But again, back to this analogy of the house, if we don't build the foundation of the house, like the pelvis and the low back, then it's really hard to treat some of the things in the upper half of the body, because it's like building a house on a cracked foundation. You're trying to build, the second and third floor on top of a cracky foundation. So I recommend that people rehab, like any patient that comes in, we would always recommend that they rehab their hip for at least a year before, as long as you've had x-rays, you've had MRIs, there's nothing that's super pressing. There's typically not a rush to do orthopedic surgery. Again, I'm not a surgeon. I can't advise you on surgery. I'm just saying, like, from a rehab perspective, these are the kind of things that we've seen. Also, depending on your age, like something like a labral repair there's really not a lot of research, or any research that I'm aware of, within this particular population. And if you're over your late 30s, the outcomes just in the regular population aren't that great for labral repairs. So many of them can be rehabbed, and it just depends on, yes, again, how significant the tear is. And I would always have a couple radiologists look at the imaging as well, because there's some subjectivity to this as well. So another thing you can do while you're going through rehab is trying to use external supports, like especially, again, to help that foundation as you're doing some of your strengthening exercises. And those can include things like sacroiliac belts, known as SI belts. There are different kinds of braces. Doing kinesiotaping, as long as you don't have any adverse reactions to adhesives. This allows you to get a little support and decrease pain while you're doing your exercises. And most importantly, it makes a window for an opportunity to move. It's not solving the underlying issue, but it helps you to give you a little external support. We always talk about making, when we're working with patients, we always talk about having both active and passive solutions. So some of the active solutions, of course, are going to be exercise, and then the passive solutions would be external supports like SI belt, orthotics, braces, body braids in some cases, things like that. And that's going to be individual, right? Like you have to work that out with your physical therapist or other providers that you're working with. So I think we should absolutely make sure that we capitalize on some of the external support, so everything isn't always an effort. So definitely get multiple surgical opinions. And there isn't a lot of evidence on these, specifically biologics. So yet there is some. Here's the issue. Like if you've never heard of these biologics, we're talking about protein-rich plasma, PRP, stem cells. And the big thing is the quality varies. So like if you're going to go down this route, which some people it does really help, and part of the issue with this is the cost. Like it's extremely costly, and it's not heavily standardized or regulated yet. So some people get significant relief from these options, but again, I would always go through physical therapy first. Do the most conservative thing first, and do your best not to lose hope. I know it's hard when you're balancing multiple things like this. If you have multiple different physical issues that you're managing at once, it's really easy to lose hope along that process. But there's always a road forward, and I do believe anyone, as long as you still have a beating heart, you can absolutely make a difference in your function. Sometimes it's just finding the right toolkit or the right set of people to build your team out. So hang in there, and you're absolutely going to find the right choices eventually, even if it doesn't seem like it right now. If you have any questions like this one, we absolutely, because the way I look at this is If we can just help move the needle a little bit, if one person is asking a question like this, certainly there are others. So if you have a question like this person, feel free to put it in the comments below, and we'll be happy to give it our best shot to give it the answer that it deserves. We hope you like this video, and if you found this helpful, you'll definitely like some of our other content, so be sure to subscribe, check out some of our other videos on this channel. Look forward to seeing you guys soon.